Ladies and gentlemen, hello and welcome to my channel once again. In this video, I have made an effort to point out the advantages and disadvantages of telemedicine. Telemedicine, as we all know, is the remote delivery of healthcare services using telecommunications technology. Doctors interact with their patients remotely to provide the required medical treatments. With easy availability of internet facilities in most areas, telemedicine seems to be growing at a comfortable pace. Telemedicine proved particularly beneficial during the coronavirus phase, both for the patients and the doctors, in preventing the spread of the virus. Since then, telemedicine has become important in the medical field. In this section, I have outlined some of the advantages of telemedicine, like easily accessible, convenient, and time-saving, improved efficiency for the doctors, cost-saving for both patients and doctors. For patients living far away, reaching out to medical experts in the major cities and towns becomes easy. Long-distance consultation has become a reality because of telemedicine. Such patients can contact the doctors without any waste of time. It is possible to even contact experts in specialized fields living in cities of other states. For patients not able to visit the doctors personally, telemedicine proves to be very beneficial. Patients can reach the doctors from the comfort of their homes or offices, shops or any other places. This is particularly beneficial for individuals with mobility issues, or those who lack the time to visit the doctor personally. Telemedicine is particularly beneficial for those seeking follow-up consultations after the first personal visit to the doctor's OPD or clinic. Patients can receive expert medical advice in a timely manner all the time. There is almost no or little waiting time to see the doctor, which they would have to otherwise do in the OPD of a hospital or in a private clinic. By utilizing telemedicine facilities, the doctors are able to streamline their healthcare services, like scheduling patient consultations, scheduling operations. Online consultations often require less time when compared to traditional appointments. This enables the doctors to attend to more patients within a given time frame. It is easy to store patients' data online and share it easily among the doctors. When they need to discuss complicated cases to come up with suitable treatment solutions, doctors are also able to discuss complicated cases with each other, even when they are situated in different locations of the country, thus leading to a better line of treatment and expert care plan for complicated cases. Moreover, for cases which require the involvement of a team of doctors, digital health records and telehealth platforms provide for easy exchange of information and collaboration among doctors, leading to enhanced coordination among the doctors in finalizing and providing a comprehensive patient care. One good feature of telemedicine is that it can help reduce healthcare costs for both patients and healthcare professionals. Patients are able to save traveling expenses. Outstation patients are able to save accommodation costs. For the doctors, telemedicine can reduce healthcare expenditures by cutting down the need for physical infrastructure and administrative overhead. The doctors are able to optimize their resource allocation in a better way. In the next section, I have given some of the disadvantages of telemedicine, like limitations to physical examination, technological problems, data privacy and security problems, limitations to personal care, unaware of the doctor's actual qualifications. Limitations of physical examination, I feel, is one of the most significant limitations of telemedicine. There is no scope for conducting comprehensive physical examinations, especially of critical, complex and high-risk cases. Certain medical conditions may require a detailed physical evaluation of the patients to arrive at a suitable care plan and line of treatment. Telemedicine does not enable accurate diagnosis of patients' medical conditions. Limitations to internet access in certain remote areas is another disadvantage. There are large segments of the population without internet connections and digital devices. People mostly from the backward classes, socially underprivileged classes, remote village areas, and in some cases, the elderly with limited knowledge of digital technology, are not in a position to take advantage of telemedicine facilities. Another serious problem is interruption in internet connection during online consultation, thus causing disruption in patient-doctor link in conversation, and may even lead to loss of vital online data. Protection of individual medical data is another major concern in maintaining patients' data online. Telemedicine is all about collecting sensitive personal demographics data and medical health data over digital networks. Therefore, ensuring patient privacy, confidentiality and data security is very crucial. Breach of security is a constant threat. It can be unauthorized access, misuse or tampering, or even deletion of vital data. It is necessary to have strict regulations in place to provide confidentiality and security of vital personal demographics and critical medical data. Another big disadvantage is that telemedicine provides limited scope for personal care. Certain types of medical conditions require immediate, personal interventions by the doctors, cases which fall under the category of emergency situations, cases requiring major surgery, cases which have to be examined with the help of medical instruments or medical equipment, cases which require personal examination, like ENT cases and ophthalmology cases, are examples of instances where telemedicine will be ineffective. In some cases, it may turn out that the person offering telemedicine services as a doctor is not suitably qualified for the service. In such cases, the consultation offered to patients may be of poor quality, which may cause more harm to the patients than good. There may be very limited opportunity for finding out the qualification details of a doctor offering telemedicine services. The picture is very clear. The disadvantages are more significant than the advantages. Telemedicine is effective only for routine and non-emergency medical cases. Therefore, it is important to strike a balance between telemedicine and traditional healthcare delivery to ensure comprehensive patient care. Traditional healthcare practices should be upheld as the dominant method for treating patients, whereas telemedicine only complements the traditional practices, thus allowing for a more patient-centric and accessible healthcare platform for all. To conclude, if you need any further information regarding any topic related to quality management and process management, then please put them down in the comment below. I will try to do justice to your requests in my new videos. If you have liked the information that I have shared with you, then please like my video and subscribe to my channel by clicking the subscribe button below. Thank you very much for watching. Good luck to you. Have a great day.